Hi, Paul Sackett's Good News Planet. I'm speaking to Dr. Gary Harper, who is a professor at the Department of Psychology and director of Masters of the Public Health Program at DePaul University, Chicago, Illinois. You are a board member of the National Runaway Switchboard, who we've spoken with many times over the years. April's National Volunteer Month. The National Runaway Switchboard has been doing a lot of good for those in crisis that are runaways, and we're going to learn about that. Unfortunately, the crisis hasn't slowed down, but you've done some research, and maybe we can learn some ways that we as volunteers can help and maybe try to get closer to eradicating this concern. Thank you, Dr. Harper, for being with us.
I'm glad to be here.
Tell us what's happening. Tell us what's happening.
So one of our strong messages is that runaway and homeless youth, that this is an issue that is still a crisis in the United States. We see that it's estimated that about 1.6 to 2.8 million youth run away from home each year in the United States. So this is a significant number of our young people that are in crisis and feel that there's no other option, that they need to leave home. So we are trying to promote more volunteerism, given that April is National Volunteer Month, and encouraging people to get involved in a variety of different ways. So one of the simplest ways to get involved is to go to our website, which is 1-800-RUNAWAY.org, O-R-G, and you can sign up to become a street team member, which is a program where you then are provided with educational and promotional materials, and you distribute those in your community and let people know about our services. Our services are available to anyone who can pick up the phone and dial 1-800-RUNAWAY, or who can go to our website at 1-800-RUNAWAY.org. And so we really need to get the word out there, and so that's a really easy, simple way that people can get involved. People can also call our number. Sorry.
Okay. No. Go on. Call our number.
So people can also call our number at 1-800-RUNAWAY and talk to one of our trained volunteers and find out what resources are available for volunteering in your community. So we have information on thousands of organizations and agencies in every city, county, state across the country. And so we can help you find a place that's convenient to you where you can actually volunteer your time.
Okay, let me ask a question about the materials. Is this a type of a material that, so say you have some kind of a sense that somebody is a runaway kid, okay? Mm-hmm. For however that was able to occur, that you got some sense, or you're sitting in a coffee shop and you're talking to somebody who has a cup of coffee, and he somehow lets you know that, I've run away, okay?
Right.
What does somebody do?
Well, I think that the easiest thing to do is to provide them with our phone number, the 1-800-RUNAWAY number. The thing is that if you don't really know that individual, they may wonder, why is this person talking to me? What do they want from me? Our phone number is very clear that it is a number that's focused on runaway youth. So that's the simplest. Also, if you do go to our website, there are materials that are downloadable that you can get off the website. If you're a street team member, you can get access to more resources. You could also hand them a brochure or a one-page sheet that talks some about the National Runaway Switchboard and its services that could serve as a stimulus for them to then pick up the phone and call the number, or to go to our website. We have a variety of youth who may want to access information through the web because they don't feel comfortable talking to someone on the phone. We also have a service where they can actually talk with people through instant messaging. So there's a variety of different ways that youth can connect with us, but they first need to know that we exist.
Do runaway youth also, do they just at some point go to the police and say, I've run away, or say they're in an abusive home? How does that work?
Yeah, it's rare for youth to go to the police because they're often concerned that if they do, that they're going to be sent back to the home. And the fact that they left the home means that things were so challenging there, so difficult, that they don't want to go back. They're much more likely to go to friends, relatives, other people that they know, that they feel comfortable and safe with. Some youth will go to social service agencies or to community organizations or agencies, maybe a Boys and Girls Club, a YMCA, some type of community agency focus on working with the community. And in those situations, oftentimes they may just casually, say something about, oh, well, I don't have anywhere to sleep tonight. It's really difficult for a young person to go up to someone and say, look, I'm homeless, or look, I ran away from home. And so it oftentimes comes out in more subtle ways or through indirect mechanisms, like they're playing basketball, and then at the end of the game they mention that they haven't been sleeping at their home for the past week.
So the callers identifying economics, neglect, and GLBTQ issues as their problems. Has that been an increase, especially with recessionary times for the economics part? Neglect is, unfortunately, maybe around too often, and then the gay, lesbian, transgender stuff. Well, how does that fit in?
Right. Well, we have seen that there has been an increase in callers identifying economics or financial issues as a problem. There's been a 27% increase over the past 3 years and an 83% increase over the past decade. Neglect, as you mentioned, is another area where we've seen an 11% increase, and then over the past year and 44% over the last decade. And those, neglect can be for a variety of reasons. But if a parent is so concerned about where they're going to get their job, where they're going to get money, it's hard at times for them to put that energy into their youth. In terms of being gay, bisexual, transgender youth, we have seen an increase in the number of callers who identify that as a primary issue or primary concern. We've seen about a 7% increase over the last 3 years and 36% over the past 10 years. And we think some of that may be due to a collaboration we have with Cyndi Lauper's True Colors Fund, which is dedicated and devoted to providing services and resources and support for lesbian, gay, bisexual, transgender youth.
Okay, I know you have a lot of people to speak to. We have, as I mentioned, spoken with you guys for many years, and thank you very much for doing the good work that you do. Last quick question, then. What's good news for you, Doctor?
Pardon?
Good news for you. Good news for you. What's good news for you?
Well, good news is that I have the opportunity to talk to lots of great people about something that I'm very passionate about, and I think that we all have an obligation to really do what we can to help promote the health and well-being of youth. And I'm just really excited that I'm able to talk to so many people and spread the word about the need for volunteers and about the great resources that we can offer for free.
Great. Thank you very much for sharing good news with us. Thank you, Doctor.
All right. Thank you.
Bye-bye.